Hello, everyone. My name is Michael Bruhn, and I am the Director of Public Policy. I want to provide you with an update on our top state and federal priorities. But first, I think it's important to acknowledge our recent policy victories. Every discussion about Alzheimer's policy victories should begin with the historic increases in Alzheimer's disease research our volunteer advocates have secured in Congress. In 2011, Alzheimer's research funding was not even $450 million a year. In fiscal year 2020, annual Alzheimer's research funding was $2.8 billion, and we're not done yet, as we're asking for an additional $354 million in 2021. We also just passed the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act through both houses of Congress. This legislation requires the Department of Justice to develop training materials to assist professionals supporting victims of abuse living with Alzheimer's and other dementias. In the remaining days of Congress, our top priority is the Improving Hope Act. A few years ago, the Alzheimer's Association introduced the Hope Act. This legislation required the federal government to create a Medicare billing code for health professionals to assist with care planning for individuals diagnosed with Alzheimer's or dementia. Unfortunately, less than 1% of eligible individuals diagnosed have utilized this care planning provided under Medicare. So when the Hope Act doesn't work as expected, we introduced the Improving Hope Act to educate clinicians on Alzheimer's and dementia care planning services available through Medicare and the importance of providing those services. At the state level, the Alzheimer's Association is leading the way to safeguard residents of long-term care facilities. The Alzheimer's Association made a series of recommendations encouraging both state and federal elected officials to take action to protect our most vulnerable citizens from COVID-19 in long-term care facilities, and to establish standards for testing, reporting, surge activation, and providing support. In August, we launched a coordinated advocacy campaign targeting governors in all 50 states in an effort to address the rapid deterioration of loved ones in long-term care facilities due to the social isolation caused by the COVID-19 pandemic that restricted visitation. The Alzheimer's Association is advocating that the only way to safely end social isolation for our loved ones in these facilities is to ensure every long-term care community has access to rapid testing for all residents, staff, and most importantly, visitors. In September, advocates from across Wisconsin and across the nation urged governors to take action on this important issue. Our success advocating for these and many other issues is a direct result of our fantastic volunteer advocates. Our Purple Brigade, if you will. Having lost 3 grandparents to this horrible disease, there were times when I felt helpless and wanted to fight back. And the best way to fight back currently is through public policy victories, providing supports and services, as well as additional research funding. If you are interested in becoming an advocate, please visit alzimpact.org/volunteer or text ALZVOL, that's ALZVOL, to 52886. Finally, our 2021 Wisconsin Alzheimer's Advocacy Day will look a little different this year. We're still putting the finishing touches on an exciting virtual program, so please keep your eyes open for invitations coming soon. We hope to see you all there. Thank you.